I got a fan. Mr. Speaker, thank you for allowing me to speak on this piece of legislation. I rise in support of this piece of legislation because I understand that there's a severe opiate issue that we are having in the state of New York. But I also want to draw the public's attention to some disparities that are taking place here. First of all, $25 million out of $1 billion or so more, $100 billion, dollar budget is not nearly enough to begin to address this issue. I learned very early in life that if you want to find out where someone's morals are or where their principles lie, you follow the money. And so when we talk about $25 million, I think it's really a joke. It is a slap in the face to the cries of the public, and we are just losing so many lives day in and day out. Not only that, there's grave concerns about not having enough treatment places and enough beds to take care of individuals when we encounter them, to truly help them to get better from this addiction. I also want to speak on the fact, Mr. Speaker, that there's racial disparities here. When there was a drug issue in the African American community, we were prosecuted, we were put in jail, children were put in foster care, families were ripped apart. It was treated like a criminal justice issue. We had Rockefeller drug laws. Our jails were filled with men and women that looked just like me and people from the 43rd Assembly District. But now, we have an opiate issue. It is affecting another demographic, and now it is a health issue. And now we have to put money into diverting individuals from prison into treatment. And so what is missing from this package is a restorative justice package for all those individuals that were jailed and for all those families that were ripped apart and for the individuals who have criminal records because they had addiction issues, just like the issues, just like the people who are suffering. So with that, I vote in the affirmative, but more needs to be done here. Thank you.
Ms. Peoples-Stokes.
Thank you, Mr. Speaker, for the opportunity to explain my vote. I do want to commend the chair of our committee here in the State Assembly, who I think traveled to a lot of communities, along with Lieutenant Governor Kathy Hochul, on a task force listening to the people across the state about how this issue is impacting them and their families. And I know that takes a lot out of you, so I want to really thank Ms. Rosenthal for her work there. I also want to join colleagues who, bring concerns as it relates to how this is really not enough money to deal with a major problem. I actually personally have attended 3 meetings in the Western New York community alone. And I have to tell you, it's really kind of very difficult to hear mothers basically still crying about their children that they have lost as a result of opioid and heroin overdoses. And so the thought that we're not putting in enough resources to try to prevent that from happening is kind of hurtful, I think, to both those parents and, quite frankly, to myself, even though they're not my children. And in many cases, they don't even look like me, but they're important people as well. I will say that there's no question that drug addiction is a disease. It's a disease now if you're addicted to opioids or heroin. It was the disease for the people who were addicted to crack. It was a disease for the people who were addicted to cocaine. Addiction is a disease. And so it's important for it to be treated like a health issue and not a criminal justice issue. So there were mistakes made in the past. People should atone for that on their own. They should look at themselves in the mirror and figure out how you're going to handle the fact that it was okay to incarcerate in the past. It wasn't okay then. But I tell you one thing for sure is it's not okay now either. And now it's time to treat addiction like it should have been treated from the beginning. It's a disease, and I'm glad that we're at least beginning to try to work towards correcting a disease through health care. With that, Mr. Speaker, I remove my request and vote in the affirmative.
Ms. Peoples-Stokes in the affirmative. Mr. Ryan.
Thank you, Mr. Speaker. To explain my vote, I commend the sponsor for pushing this through. And the bill is really a two-pronged bill. One, it addresses the treatment for those currently suffering, and there are some efforts being made to stop the people from being addicted. I would hope that in the future we concentrate more on the second prong, which is to stop people from becoming addicted. We need to change our med school education to achieve that goal. We need to change how we educate people in residency programs to achieve that goal. But we also need to change how we interact with the public on treating this as a public health issue to achieve this goal. We need to really reset our public expectations about the use of opiates. Somehow we've gone from a community that's accepted opiates for end-of-life cancer treatment to a community that accepts opiates for wisdom teeth and sprained ankles. And we see the public health outcome of this, and it's an awful, it's a painful, and it's a destructive public health outcome. So we need to work together to change all those public health exceptions, and we need to have the courage as a state to set a goal. How many opiate prescriptions do we think we need in this state? Because right now they're just being set by the pharmaceutical companies who will tell us we could use more opiates for just about anything that ails us. So we really need to work together on that. And the final point, Mr. Speaker, is 80% of addicts report that the first time they tried an opiate was from an FDA-approved product. This is not a black market product. This is a product made right here in the United States of America by United States pharmaceutical corporations. We need to look at the life cycle of these products, how they're going from the prescriber to the patient to the medicine cabinet, and then from the medicine cabinet all around our neighborhoods. So we need to get these products back into disposal sites and out of the hands of our community. And with that, I withdraw my request to explain my vote, and I cast my vote in the affirmative.
Mr. Ryan in the affirmative. Ms. Rosenthal.
To explain my vote, we have all heard the heart-wrenching stories of families being torn apart by addiction and overdose. As chair of the Committee on Alcoholism and Drug Abuse, I've been honored by the opportunities I've been given to hear from people from across the state about their struggles with substance use disorder and their suggestions about how to tackle the heroin and opioid addiction head-on. It is for these people who fight and for everyone who lost their fight with addiction that we act today. We act to save lives, to send a message of hope into communities that we hear and see them, and that we must do more to support them in their hour of need. For too long, we treated addiction as a crime and sentenced those struggling with a substance use disorder to jail. For years, people battling addiction have faced institutional barriers to treatment. We have learned that the most effective way to get people healthy is to partner with them to create a care plan that includes easy access to medication-assisted treatment and other supportive treatment and recovery options. I'm pleased my bill will help to reduce some of the barriers that have made it difficult to access effective treatment. By prohibiting insurance companies from requiring patients to seek inpatient addiction treatment prior approval, we ensure anyone who makes the decision to get healthy can do so without medically unnecessary bureaucratic obstacles in their way. On the prevention side, the bill will allow pharmacists to counsel people receiving opioid addictions and will also prohibit doctors from prescribing more than a 7-day initial supply of opiates. This bill will also ensure that doctors, who for years have opposed measures requiring them to be trained to prescribe opioids, receive 3 hours of medical education every 3 years to ensure they are partners with us in the fight to prevent addiction and overdose deaths.
Ms. Rosenthal, how will you
I will
vote?
continue on the next bill, but in the interim, I vote in the affirmative.
Thank you. Mr. McDonald.
Thank you, Mr. Speaker, and I want to thank you for your support. I want to thank Member Rosenthal for her leadership and all of our colleagues on both sides of the aisle as we deal with this crisis that's plaguing our state and our country. These bills that we are voting on today focus on the four core elements of education, enforcement, recovery, and treatment. The bill today that speaks to pharmacists providing state-issued information on education supports the ongoing counseling that pharmacists have always done when it comes to dispensing of any medication, let alone opioids. The requirement for physicians to take training for those who prescribe opioids makes perfect sense. And the limitation of opioids for patients when they first receive an opioid for acute pain to a 7-day supply addresses the chronic oversupply of unnecessary medications. We need to cut the serpent off at the head, and this is a process to do that. And we also need to do, as we continue to say we take steps, realize this. This is a step of a 1,000-step journey. Today we take 3, 4, 5 more steps forward, but we all need to start looking at drug addiction as what it is. It's a medical issue no different than hypertension, no different than diabetes. It needs a true comprehensive medical approach. And with that, I vote yes on this bill.
Thank you, sir. Ms. Arroyo.
Thank you, Mr. Speaker. Before I make my statement, I want to congratulate Ms. Rosenthal, the chairman of the committee, for the professionalism that he had shown working in this issue. I have to thank the Speaker for the initiative of dealing with this problem. For years, we have been struggling seeing our children going to jail because they catch them with a piece of something that is illegal. But today, that the disease moved from the South Bronx and Brooklyn someplace else, now it's a health problem. And I'm so glad to hear that I heard one of my brothers here said, we have to work together. Because now the disease is in the backyard of our house or probably sitting in the living room. And we have to work together, and I think that we have to command the governor that $25 million is a drop in the bucket in the budget of the state of New York, and he should put more money, at least triple that amount of money for the treatment that we need. I cannot continue speaking because I know that we want to go home. Again, Ms. Rosenthal, God bless you. You are a star in this house. Thank you very much.
Thank you, Mr. Arroyo. Ms. Walker.
Thank you. I like to associate myself with many of the statements I've heard here today by my colleagues. But we just had this conversation a couple of days ago. And this conversation was about marijuana. And it was about a criminal justice issue. It was about stealing of records that we know have devastating effects on the economic opportunities and educational opportunities for thousands of young African-American and other members of color in our community. But today, the conversation has taken an interesting diversion. I also understand that I heard one of my colleagues says that the issue that we're talking about today, this issue of drug use, has no race, no religion, and no economic background. And I'll agree wholeheartedly with that statement. But I do submit that the way that we are addressing this issue does. For far too long, this has been an issue that has been hidden in many communities. And people used to come to communities like Brownsville, like the community that I represent, and receive the type of treatment and needle exchange programs to deal with the drug usage that they're facing in their lives. But now these same community organizations are canceled out of the treatment options in terms of being a requisite place where people can go to provide the type of preventative strategies that they deserve. So I really want to impress upon each of my colleagues, both on this side, on the Senate, and also in the executive office, to say that as we are looking at opportunities to address this issue, that we utilize the type of colorblind initiatives that was talked about here earlier, and let's make sure that we are spending these resources in communities of color, because we need these types of initiatives as well. So again, I look forward to voting on this entire package in the affirmative. Thank you.
Ms. Walker in the affirmative. Mr. Rivera.
Thank you, Mr. Speaker. I want everyone to know that Eric Fuentes, my intern, is one of the best that we have seen in this assembly. What I'm saying is that the intern program and the speaker give us the finest. I hope those youngsters, those children that are up there, as they continue to grow, that they can look to be an intern in this legislative body. Now, about this issue, I just want to commend the sponsor of this bill. I want to let her know why I'm voting. It will not solve the heroin use habit in our society. I have seen my neighborhood, and the reason why I'm saying this is because one of my good friends from the other side, I have many good friends on the other side. They're all my friends. We don't always agree, but they're great. And I hope I can take you for a slice of pizza in my borough in the Bronx. But someone said, what is happening? Share with us what's happening out there in Long Island. Well, guess what? It was happening when I was growing up in the borough of the Bronx. I saw my community destroyed because drug, heroin, and other bad habits. It gets worse. I see my island of Puerto Rico destroyed today, an island that never had any crime, because we cannot stop. We, as a people, as a nation, with all the military might we have, we cannot see. And 20 bases, military bases in Colombia, we cannot seem to stop heroin being brought in to the United States mainland. We can't seem to do that. We're not going to be successful until we stop. And as long as there's a lot of money, dirty money, being made by powerful people, we're going to continue to have this problem. So therefore, this might not solve the problem, but it will definitely help, and it's a step in the right direction. You don't want to spend the money? Let's put pressure on Washington to stop the drug from coming to this country.
How do you vote?
Mr. Speaker.
How do you vote?
Mr. Tatone. Mr. Rivera votes yes.
Well, that's good news. I've seen this movie before. Many of us have seen this movie before, and let's review how it ends. We have an addiction epidemic. Hypodermic needles are used in exchange. Now there's diseases that are transmitted from the exchange of needles. But the addiction also causes loss of financial means. So we see an increase as well as in the sex industry. So when we talk about addiction and the problems, it's not enough that we just speak about the treatment for the addict. We also have to start to really prepare for what we've seen before, back in the 80s, back in the 90s, the crisis, the epidemic of an increase, not only in HIV/AIDS, but hepatitis C. We're going to see an increase in sex workers who are unprotected, thus really, again, increasing the population and more young people becoming infected by that virus. So I think this is a great start, but as a legislative body, we really, the reality is that we're not looking at the entire problem. And certainly we've had members talk about minority communities and the impact in the past. Well, mark my words, we have seen this movie before, and we cannot allow it to be repeated. Thank you, Mr. Speaker. I'll be voting in the affirmative.
Mr. Tatone in the affirmative. Read the last section. Are there any other votes? Announce the results.
Ayes 125, noes 0.
The bill is passed.
Assembly 10,726, Rules Report 486, Committee on Rules, an act to amend the education law.
An explanation is requested. Mr. Cusick, on a motion by Mr. Cusick, the Senate bill is before the House. The Senate bill is advanced. Mr. Cusick.
Thank you, Mr. Speaker. This bill in the package of bills that we have before us will address the overdose issue. In this bill, it removes restrictions on administering Narcan for licensed professionals such as social workers. It institutes a quarterly data reporting of overdose and Narcan use between the state and counties, and it puts into place hospital discharge planning for identifying people with substance abuse disorder and trying to direct them to substance abuse treatment after their discharge from hospitals.
Mr. Graf.
Aye. Will the sponsor yield?
Will you yield, Mr. Cusick?
Absolutely.
Sponsor yield.
Great. Now, Part C of this bill, we give information, alcohol, substance abuse, oasis, consultation with, we give individuals different information on services that are available and stuff like that, right?
Yes.
Do we give this information to parents or to family members upon request also?
It's not specific. It's not specifically in the bill.
All right. Does it prohibit them from giving it to families information? Do we set up a website or anything?
Well, let me answer the first part of that. It does not prohibit that.
Right. Do we make this information available online?
The bill does not require it being online, but it can be put online, yes.
Now, do we make Oasis or the health department responsible for helping with placements into rehab centers or detox centers?
The bill addresses it. There will be a referral to a provider in the area. That's
Right.
what the bill addresses.
But when we talk about a referral, we can say that you have a rehab near where you live, or do we have a database, or do we instruct Oasis to have a database?
We don't. Oasis has a database of those providers, so that the person would be pointed to the provider in their area that they could go to.
Okay. But do we have, see what I'm trying to get at, and I apologize,
That's okay.
is the problem that I've heard is when a person wants to go into rehab, they'll go in, they'll apply, they'll take all the information, and it'll take them a month because there's no availability. All right? And, I mean, once you have a person ready to go into rehab and we're waiting a month for them to actually get in, 9 times out of 10 or more, we've lost that person.
Right.
So what I'm wondering is does this create some type of database that Oasis or the Department of Health has to monitor where the rehab centers have to call in and let them know the number of beds that are available, the number of patients that they have, and what can we depend on Oasis to turn around and say, okay, yes, we'll assist you in getting a bed? Do we set anything up?
Again, the issue of a database already exists that they're going to refer people to neighboring resources. The issue of what you address about the resources available for people who want to get into treatment immediately, and what you address, Al, is in everybody's district, and I know you've worked very hard on your task force, and you've heard people say this. What we think is that that's part of a funding resource issue that we are hoping that we would get the funding required to provide that people will be able to get into these treatment centers quicker than they are now.
Yeah. Well, and what I'm looking at is that if a person may be in Suffolk County, there's no open beds, but there may be one in New York City, there may be one in Westchester, that now Oasis assists that person into getting them placement prior to them just going there.
The database will say that.
Will it say that? But what I'm looking for is the state to coordinate this, the state to organize this, the state to help with the referrals, the state to help fill the beds, and vice versa. If somebody's in the city and there's nothing in the city, and I have one on Long Island, you know, that person, I know that this day it's available.
Right.
So we're going to assist you getting into that rehab.
Right. No, that's a good point, but that is not addressed in this bill.
Okay. Now, if the person comes into the hospital, they've overdosed, and brought back by Narcan, you know, I know later on I'm going to talk in the other bill that there's a 72-hour hold.
Right.
And in some cases, like if you have a senior and they're brought into the hospital, they can't release them to the street. Okay, it's against the law. They have to be able to make sure they're going home to a safe environment. And I mean, you wouldn't say that if a person just OD'd and brought back from death, he's a danger to himself. You'd agree with that?
Yes.
Okay. Do we require the hospitals under this to actually make sure that the person goes from the hospital to rehab or to detox?
We do not require that in this bill.
Okay. Last one.
Yep.
Is we talk about there's an education component to this bill. And we talk about the combat rise. There's also DOH to disseminate data related to opioid overdose and opiate deaths so that counties can better determine how to combat the rise of heroin.
Right.
Do we do anything with the schools? So one of the things that I've heard out there when we talk to everybody was in the elementary schools, we used to have programs, resource officers, the DARE program. And they say in the lower grades, that type of thing is appropriate. Right? But then once you get to the middle school, it's important to have peer-to-peer counseling, because by the time they get to middle school, if somebody our age talks to them, it sounds like the parents from Peanuts, Wawa, you know. So, I mean, are we doing anything to fund education and to actually be able to look at these programs and put back the prevention part of it? Because with the Common Core, and we're getting away from Common Core, thank God. Thank you, Kathy. We're getting away from Common Core in a lot of areas. We got a lot more work to do there. But opening up part of the school day so that we can bring this type of education to the schools, because we're falling down there. So we talk about educating, and we're throwing it on the counties. But we need to do something with education. We have to direct the Department of Education that not only should you do this, but you're going to do this.
Right. No,
do we do anything like that?
Al, those are good points, and I know that many of us in our own districts who have roundtables and talk about this issue, the education piece comes into play. You're right, we have to educate people. I know personally in Staten Island, the local police and the borough president go into the local schools and they talk about it. They talk about treatment. They talk about the heroin and opioid addiction. But this bill does not address the funding that you had talked about that would be needed for this. And this bill does not address the issue of going into the schools.
Okay. Well, my point to this is to show the holes. I mean, it's a first step. And when I said the last bill was a baby step, I think it's like a third of a baby step. This is another third of a baby step. The last one will be another, we'll get one baby step where we need a giant leap. And, you know, I'm hoping that by having this discussion, we can move this forward further. We can make people think, and we can make, and I'm hoping that when people listen to the things that we don't have, they're already forming ways of putting legislation in next year to address the issues that we're going to address.
No, and I know that I appreciate it, and the folks on our side of the aisle appreciate it, because all of us are facing the same issues that you have witnessed with your task force. And it is, you're right, these are steps, small steps going forward. And like you said, I believe as we go on next year and year after, we will be working and building on these pieces of legislation that we put forward here today.
Okay. Thank you very much.
Read the last section.
This act shall take effect immediately.
Clerk will record the vote. Mr. Saladino to explain his vote.
Thank you, Mr. Speaker. I just want to speak to the issue of thanking the sponsors of this issue. We had brought this sponsor a bill about 3 or 4 years ago that was one of the building blocks for this, and I'm very much appreciative of his embracing that at the time and now. I want to thank the work of people who have worked on our task forces here in our conference, people across our state, people on the committee, and right to the governor's office. A lot of people have wanted to see legislation like this passed, including the moms, the parents of those children who have been devastated, people back home on Long Island where we have the highest death toll of any county in our state, like Terry Kroll, the mother of Timothy who passed, Sharon Sikowski, the mother of Jonathan who passed, Linda Ventura, whose son Tom is a survivor and continues to battle, Janice Talento, who heads up Drug-Free Long Island. I personally have had over 5 friends who have lost a child and motivated me years ago to get involved. And I want to thank all of those. I know in our task force, the leaders of our task force did a lot of work traveling across the state. And I want to thank them for their efforts and all who put in time. And a lot of issues have come up on this legislation, including the frustration of those in communities who have been hit for decades. And I want them to know that we are very sympathetic. But the best way to get this solved is if we all work together and not be divisive on the issue, but make sure that we are of one team. Someone in this room told me something that I try to live by. You don't need a title to be a leader, and I thank all of the leaders who made this happen. I'll be withdrawing my request and voting in the affirmative.
Mr. Saladino in the affirmative. Mr. Castorina.
I'd like to thank the sponsor of this bill. Mike, you've been a real champion on these drug issues, and Staten Island thanks you. I sure do. This is really devastating my community right now. We're looking at, on the average, about 3 or 4 overdoses a week. It's absolutely destroying the community. It's devastating. This is not only a public health issue, it's also a criminal justice issue, and we need to address it. Right now, we have drug dealers that are purposely making hits of heroin that are guaranteed to kill people. And they're doing that, and they're adding it to their batches of their sales so that somebody will die. And when somebody dies, people in the heroin community say, whoa, he's got some good stuff, we should buy from him because it's stronger. And we need to do more about making sure that criminal liability is going to go back to those drug dealers who are making purposely people die for the benefit of their own pockets. We need to make sure that our criminal justice system isn't allowing drug treatment court to be an avenue for drug dealers to just pass through and not face real consequences. And so we have so much more to do, but for now and for today, I'd like to take this opportunity to thank the sponsor, and I will be voting in the affirmative. Thank you.
Mr. Castorino in the affirmative. Ms. Peoples-Stokes.
Thank you, Mr. Speaker, for the opportunity to explain my vote on this last package of bills that we are proposing to get us towards healthier communities. I do want to mention one thing, Mr. Speaker, is that when folks are addicted to heroin, it can be treated. And I suspect, and I think the treatment would go further and better if people could receive that treatment in the communities where they live. Right now, in my district, there are at least 2 methadone clinics, and they're not new. They've been there for a while. The only thing that's different now is that because they're not methadone treatment facilities outside in enough numbers, the city of Buffalo, where people are using the most heroin at now, they have to come in. And that's, we don't mind sharing services, but when you need something, you shouldn't have to go into another community to get it. You should be able to get it in your own community. Now, I understand a lot of people are still into this not in my backyard thing, where you don't want this sort of treatment in your community. Well, you need this sort of treatment in your community because your children, your sons and your daughters, your brothers and your sisters have a disease, and you need to be willing to treat them where they live. And so, Mr. Speaker, while I think that this work has been great that we have done here so far, I agree with my colleagues who have spoke earlier that said that we need and we should do more. And I look forward to being a part of the team that gets that done. Thank you, Mr. Speaker. I withdraw my request and vote in the affirmative.
Ms. Peoples-Stokes in the affirmative. Mr. Murray.
Thank you, Mr. Speaker. To explain my vote, it was 5 years ago this Sunday that a tragic event took place in my district. It was the shooting at the Haven Pharmacy. Some refer to it as the Medford Massacre, if you will. It was on Father's Day, as this Sunday will also be. It was an extremely emotional time for our entire community, but it also served to bring light to this problem. And I think it really did start to highlight this terrible epidemic that is spreading. But I want to sincerely thank the sponsor of this bill because let me tell you, right after that happened, we held hearings in my district with law enforcement and drug treatment counselors and others. First guy jumps in his car, comes from Staten Island to the east end of Long Island to participate in this was the sponsor. And I greatly appreciate that. There's no doubt in my mind how dedicated he is to this. And it's because of his dedication and this House's dedication that we moved forward with the iStop program and took steps forward in that manner. And now with these bills we're discussing today, we are taking steps forward. And I truly do appreciate the sponsor and all of you here that are supporting these bills because we do need to come together. This is an epidemic, and we do need to take the steps to bring this under control. So I am very proud to vote in the affirmative. Thank you, Mr. Speaker.
Mr. Murray in the affirmative. Read the last section. Are there